And hi again, my name is Dylan Black. Welcome to Daytime Ottawa on Rogers TV. Of course, it's back to school time. Did you know that 80% of classroom learning is visual, making a child's vision an essential tool that should not be neglected? To help us with that today, some tips, some tricks. He's the president of the Ontario Association of Optometrists, Dr. Joshua Smith, that joins us. Hello, doctor.
Hi, nice to
have you here. Nice to meet you. Tell us about your professional association.
So the Ontario Association of Optometrists represents over 1,700 optometrists across the province of Ontario, from my little town in Alexandria, the far eastern reaches of the province, all the way out to the border with Manitoba. We have optometrists in over 2,000 communities across Ontario.
My goodness, and you're the president. That's a lot of responsibility.
It sure is, yes. It's a lot of work, but it's very enjoyable too.
Now, I mentioned classroom learning very visual. So obviously kids' eyes need to be their best.
For sure. I mean, about 80% of how the information that kids take in is visually received, and so if their eyes are not working well together, as well as each individually working well, they can struggle even just learning to read. So even the most basic things that they learn at the beginning of their school years.
And you suggest that putting an eye exam should be on the list of back-to-school things that the parents are doing for their kids.
For sure. So we do recommend that kids receive at least one eye exam before they start school. So in that sort of 2 to 5 year old age category. But in fact, even before that, optometrists can have a look at your children's eyes even between 6 and 12 months. That's what I recommend to all of my patients that come in that are new parents. We try to have their kids in at that 6 to 12 month point to make sure their eyes are developing well and actually developing in full health. And that back to school or that preschool exam is really to make sure that as they continue to grow and change between 2 and 5, that they're ready to start school.
Okay, those exams are covered by OHIP?
Yes. OHIP covers all eye exams for children between when they're born up until they turn 20. So age 19, right up till age 19, they are covered for their visits.
So there's no excuse.
There's no excuse in that sense, for sure. Yeah. It's incredibly important. I think the biggest part of why people don't go is perhaps they don't know why it's so important.
Okay, and another big issue is the parents would assume, I guess, that kids tell them that there's issues with their eyes, but that's not always the case.
For sure. So kids don't always know when they have a vision issue. You can imagine that just how they see the world and how they perceive it is how they've always seen it. A lot of visual issues they start when a child's very young. So they don't necessarily know that how they see things is not how you see them as their parent. It's only until when they're about 10 years old or so that they actually will even start comparing to another child. So at that point they might realize, hey, how come my friend can see this object or can read this and I can't? So by the time they're 10, we've already missed a really golden opportunity, a really important window up till about age 6 to correct a lot of those developmental issues.
Okay, and you know, obviously learning, social problems, literacy problems, athletic problems, all these sometimes can be a result of poor vision.
For sure. I think sometimes people think if their kids do well in school that there's really nothing that could be wrong with them in terms of their vision, and that's not always the case. For certain, if the eyes aren't working together, a young child might have trouble with depth perception, for example. And this isn't always or only limited to when you have an eye turn. So sometimes you'll see a child where one eye does not line up with the other one, and that eye that's not lined up with what they're trying to look at, you can imagine is going to have vision issues. But there are other issues that can come that aren't even perceptible to you as their parent. So, for example, when I was in school, I went to the University of Waterloo. We had my very first clinic day. My very first patient I ever saw was, well, the first 3 patients actually were 3 siblings. And we were at an early year center in Cambridge, Ontario. So this is for kids sort of before they even start school. And the mother came with her other 2 kids as well. And the youngest was fine. She said, "Would you mind if you check my other kids just since I'm here?" And we had time, we did it. And I had to call my supervisor over because something didn't seem right. The oldest of the 3, who was 9, as soon as he covered one eye, read all the letters on our chart, covered the other eye, and actually said, "Well, I can't see anything." We said, "Oh, what do you mean you can't see anything?" He said, "This is my bad eye." And his mother was really upset, and it turned out he had what we sometimes call a lazy eye, and the real name is amblyopia, but essentially it's an eye that just doesn't see as well as the other one, and there are reasons for that. Often we can correct those reasons, but of course he didn't have an eye turn. He had no reason that his mom thought that he actually had a vision issue.
Get those eyes checked. About 2 minutes left here, and I know that you brought some. Now, this is specific for children, what you brought. So this is an eye chart?
Yes. So a lot of parents wonder, gee, what are you going to do with my 3-year-old? So this is an eye chart that has a lot of symbols or pictures on it. There's actually only 4 different pictures here, and as you can see, they go all the way down to a very small level. So we can get kids to identify this as an apple or a heart, whatever they want to call it, a house, a square, and a circle. And if they're young enough, they might call this the ball and this a box. But they can usually identify these even by age 4 or so. And if they're shy or not too sure, they can actually use this type of card just to match. When I point to something on this chart, if they're holding this, they can just show me the one that they see. So this way we can see how well they're seeing it, even at a very young age.
Okay, and some of those other tools you brought with you, now these will help with the prescriptions?
For sure. So this little guy is actually just someone I use to help kids make sure they can actually follow something that's interesting. So
Does
you've
he
got
have a
Dr.
name?
Duck.
Dr. Duck.
Yeah, just simply
Nice.
Dr. Duck.
That works.
He's got his nice glasses, his stethoscope, and his coat, so he's interesting to follow.
Yeah.
Now this is a retinoscope. And with this retinoscope and these 2 devices next to it, these are called lens bars. We use this to actually measure a prescription in a child when they don't have to use those big glasses and try to tell us, which is better, 1 or 2. So this is actually an objective measurement of what their prescription is. So this way we can actually prescribe glasses for kids if they need them at a very young age.
Okay. What's the best way to find out where to find an optometrist that specializes perhaps in children?
So the website findanyedoctor.ca is the best place to find an optometrist in Ontario. And if you go on that website, you'll find any doctor near you if you enter your postal code. And you'll also be able to find doctors that specialize in kids exams or are willing to accept kids right down to the infant age. So findanyedoctor.ca is your best resource.
Okay, all right. Well, we appreciate your time here today. And do kids, are they hesitant a little bit when they come in?
Perhaps, but Dr. Duck usually helps. And you'll find any office is going to have some pretty cool toys that make kids feel at home.
That's great. Thank you very much, Dr. Joshua Smith, findanyedoctor.ca.
Thank you.
Appreciate your time, and more daytime coming up in moments on Rogers TV.